Namaskar, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and a lot of patients ask us whether they should be fasting before providing the sample for their thyroid blood test. I'm going to clarify this in today's video because this is a pretty common question and there's a lot of confusion about this. Up to the early 2010s or the late 2008 2009, the prevailing view was that whether or not you're fasting, it doesn't really make any difference to the results of your thyroid blood test. Doctors used to say that you should ideally provide the sample in the morning, but there was no hard and fast rule as to whether you need to be fasting before providing your sample, whether you need to control how much you eat, how many hours you should fast, at what time should you provide the sample. There was no real guidelines. There were no real guidelines about this, and in fact even today there are no real clinical guidelines about this or laboratory testing guidelines that say you must be fasting. What I'm going to tell you is that there has been some research which was done in 2014 and even later in 2024-25 which proved beyond doubt that if you provide your blood sample for the thyroid test 2 hours after a meal, after a heavy meal, there is a significant reduction in the level of the TSH result. So to make that simple for you to understand, the TSH or the thyroid stimulating hormone is the main test that doctors look at in your thyroid report. Your thyroid report usually contains 3 results, the T3, the T4 and the TSH, and the TSH is the most important one. If your TSH level is too high, doctors will say that your thyroid is not working appropriately and they'll prescribe some medications for you. On the other hand, if the TSH level is too low, doctors would say that your thyroid is actually overacting and they'll also maybe give you some medicines for that or treat it surgically or whatever. But what's important to note is that if your TSH value is just a little bit above normal, or maybe it's at the very upper limit of normal, which is usually 4. So imagine if your TSH value is 4 or 4.2 or maybe 5. This condition is called subclinical hypothyroidism, in which basically your thyroid is not working properly but still more or less close to normal. And these are the situations in which the timing of your thyroid sample and whether you're fasting or not can make all the difference. For instance, let's imagine that if you had provided your sample in the fasting state, that means you have been fasting for 8 hours, then you provide your blood sample and you get your thyroid results measured. Now let's say that in that case your result would have been say 5, which is above normal because only up to 4 is normal. Now let's say that on the same day you have a meal after that, you have a nice heavy breakfast, and 2 hours after that you provide another blood sample and you get the same TSH level measured again. It's very likely that this TSH level will now drop to below 4 or maybe become 4. So you can now understand that if the doctor had made your diagnosis based on the value that was measured before you had your meal, they would have said there's something wrong with your thyroid. But if they had made a diagnosis based on what the value was after your meal, they would say you don't have any thyroid problem. And that is why even in the research they proved that nearly 75% of cases were wrongly diagnosed just because of this difference in when the sample was collected. So to be on the safe side, my recommendation as someone who does a lot of blood tests in my laboratory, provide your sample after fasting for 8 to 12 hours. That means you eat nothing in those 8 to 12 hours. You can drink as much water as you like. Provide your sample preferably in the morning. Don't fast from say 6 in the morning to 2 in the afternoon and then give your sample at 3 o'clock. Because not only does food make a difference, but timing of the day, there are a lot of changes in hormonal levels in the morning as against the evening as well. So if you want to make sure that you don't have any of these variables at play in your report, provide your sample around 8 in the morning after fasting for almost 8 to 10 hours. And then check what your results are. This will probably be the most accurate and reliable estimate of your thyroid levels, irrespective of which lab and which technology is used to measure the levels. So I hope this clears up the confusion. If you have any questions, please leave them in the comments below and I'll do my best to answer them as soon as possible. Thank you.